Attitudes, policies, and laws affecting transgender people and families are rapidly changing. To help you keep up, Forge has developed this presentation that looks at the current state of many of the policy issues that most affect trans people and families, including employment, healthcare, identification documents, housing, education, the military and veterans, violence against trans people, taxes, aging, incarceration, and trans-specific cultural competency training. My name is Loree Cook-Daniels, and I am Forge's Policy and Program Director. To make this presentation more fun, we invite you to test your own knowledge of trans policy issues by downloading and completing a quiz available at the URL you see on your screen. Feel free to stop this webinar now so that you can retrieve and take the quiz. Once you have marked your 20 questions, restart this webinar from where you left off and use the quiz sheet to keep track of the true answers. You may surprise yourself. First, we are going to take an overview snapshot. Our first question is number 1. Since 2008, the Republican-dominated Do-Nothing Congress has passed no laws explicitly protecting transgender people. True or false? The answer is false. Congress has passed 2 laws providing explicit protections for transgender people. The 2009 Matthew Shepard James Byrd Jr. Hate Crimes Prevention Act and the 2013 Reauthorization of the Violence Against Women Act. Question 2. Future federal programs will be based on actual data on trans people. Starting this year, federal surveys will begin asking gender identity questions. True or false? The answer is true. In October 2013, the largest federal phone survey, the Center for Disease Control's Behavior Risk Factor Surveillance System, also known as the BRFSS, began offering states an optional module that will collect data on gender identity. Other federal agencies testing gender identity questions will be building on the results of this first national survey. Question 3. The White House has hosted multiple meetings specifically on transgender issues. True or false? That answer is true. The White House sponsored 2 transgender meetings in 2011, including one specifically on violence against transgender people, and has since sponsored Transgender Day of Remembrance events and invited transgender advocates to numerous social events with the President and/or Vice President. Let's move on to employment issues. Question number 4 is, transgender employees are protected from job discrimination under Title VII of the Civil Rights Act. True or false? The answer is true. In April 2012, the U.S. Equal Employment Opportunity Commission ruled that transgender people are protected from employment discrimination under the sex discrimination prohibition of Title VII of the Civil Rights Act. It may be important to note that as with every law or policy, making something illegal does not make it disappear. Individual trans employees who are discriminated against by employers will still have to file and pursue formal and lengthy complaints in order to enforce their right not to be discriminated against. Now we'll move on to health care. Question number 5. The Affordable Care Act outlaws health insurance companies' exclusions for transgender-related care. True or false? The answer is probably true. On July 12, 2012, Leon Rodriguez, the Director of the Office of Civil Rights for the U.S. Department of Health and Human Services, issued a public letter affirming that, quote, sex-based discrimination includes discrimination on the basis of gender identity and sex stereotypes under Section 1557 of the Affordable Care Act and is therefore not permitted. However, it is up to the various states' insurance commissioners whether they will accept health insurance plans that still have a trans exclusion. 4 states, California, Colorado, Oregon, and Vermont, plus the District of Columbia, have already done so. If you live in a state that has allowed health insurance companies to continue having a transgender exclusion, and your health care is denied because of that transgender exclusion policy, you will need to fight that by filing a formal complaint with the federal government. You can find information on how to do this from the website of the U.S. Department of Health and Human Services Office for Civil Rights. Although filing a formal complaint can be draining and can be a lengthy process, we will need individuals to challenge such exclusions on a case-by-case basis until or unless further action is taken by states or the federal government. Let's move on to a related question. Number 6, the Affordable Care Act requires health insurance policies to cover gender-related surgeries. True or false? The answer to that is a little unclear. There is currently no explicit federal legal requirement for group or individual insurance plans to cover transition-related care. However, some advocates believe that the non-discrimination provision we previously discussed may be applied to transition-related care as well. Plus, as of 2012, at least 42% of Fortune 500 companies offer at least $75,000 worth of coverage for gender reassignment surgery for employees. Forge has also helped prepare and file a petition to Medicare to cover gender-related surgeries. In other words, Forge believes we are well on our way to gaining universal coverage of gender affirmation surgeries. So have hope if you want such surgery and do not currently have insurance that covers it. Question number 7. The U.S. Department of Health and Human Services has asked transgender people to share their stories of healthcare discrimination so that it can better outlaw such discrimination. True or false? The answer is true. Although the deadline for submitting such stories, September 30th, 2013, has passed, we are hopeful that the stories HHS received will result in more effective non-discrimination regulations. Thank you to all who shared your experiences. We will now move to policy changes around identification documents. Question 8. True or false, your regular physician is all you need to change your gender marker on either your passport or your Social Security account? The answer to that is true. To get a gender marker changed on either a passport or your Social Security account, all you need is to fill out the appropriate forms and include a letter from your physician on their letterhead testifying that you have had appropriate clinical treatment for a gender transition. No additional details about what that means are required. Question number 9. The federal government routinely outs trans people by telling employers that the employee used to have a different gender marker. True or false? This answer is false. The Social Security Administration used to issue no-match letters to employers when an employer's data did not exactly match an employee's records, including their gender marker. But this practice was stopped in 2011. This picture is of the opening of a transgender housing facility with services that opened in Chicago recently. We are using it to mark our transition to the topic of housing issues. Question 10. It is illegal for federally funded housing programs, including homeless shelters, federally insured home mortgages, and congregate housing, to discriminate against transgender people. True or false? The answer is true. In January 2012, the U.S. Department of Housing and Urban Development, HUD, issued regulations explicitly prohibiting discrimination on the basis of gender identity, sexual orientation, or marital status. Like other non-discrimination provisions, you may need to assert your right to be free of discrimination by filing a formal complaint with the federal government if you believe you have experienced discrimination. Complaints can be filed by phone at 1-800-669-9777 or online at the HUD website. Our next topic is the education rights of transgender and gender nonconforming children and youth. Question 11. True or false, the federal government has ruled transgender students must be treated equally according to their gender identity, not the sex they were assigned at birth. The answer to that is true. The U.S. Department of Education has engaged in several consent decrees mandating the equal treatment of transgender students based on Title IX of the Education Amendments of 1972 and Title IV of the Civil Rights Act of 1964, prohibitions against discrimination against students based on sex. Did you know that transgender people are roughly twice as likely to be veterans of the military as are non-trans people? That fact makes it crucial for trans people and their service providers and allies to know about military policies affecting trans people when they are in the military and after they have been discharged or retired. So question 12 is, transgender people can now openly serve in the U.S. military. True or false? The answer is false. The repeal of Don't Ask, Don't Tell did not affect the prohibition against trans people openly serving in the military. However, there are increasing numbers of members of the military and veterans who are openly identifying as trans. One such veteran recently funded a $1.3 million effort to overturn the ban. Let's move to question 13. The Veterans Administration has directed all staff to be respectful of transgender veterans. True or false? The answer is true. The Veterans Administration issued its first transgender healthcare directive in 2011, which it revised and reissued in 2013. Among other things, it directs VA staff to provide care to trans patients, quote, without discrimination, in a manner consistent with care and management of all veteran patients. We are now going to move on to an area of deep concern to many trans people and families, violence. Question 14. It is now illegal for any organization that gets money from the Violence Against Women Act to discriminate against transgender people. True or false? The answer is true. In March 2013, Congress reauthorized the Violence Against Women Act and included a new provision forbidding anyone funded under the Act from discriminating against people based on, among other things, gender identity and sexual orientation, effective October 1st, 2013. Forge has a contract to train providers to help them adapt their services and practices accordingly. We can also help you file a complaint if that is needed. Question 15. There is a specific federal law making it illegal to commit a hate crime against a transgender person. True or false? The answer is true. In 2009, Congress passed and President Obama signed the Matthew Shepard James Byrd Jr. Hate Crimes Prevention Act. This historic legislation was the first federal law to recognize the existence of and provide civil rights protections for transgender people. Next is everyone's favorite topic, taxes. Question 16. It is illegal to deduct as medical expenses the cost of hormones and gender-related surgery. True or false? The answer to that is false. In 2011 tax case, O'Donovan versus the Commissioner of Internal Revenue made it legal for trans taxpayers to deduct these expenses. Now to what we are all doing, aging. Question 17. There is a federally funded National Resource Center whose mandate explicitly includes covering transgender aging issues. True or false? The answer is true. The National Resource Center on LGBT Aging, at the URL you see on your screen, has more than 80 resources listed under the topic transgender. Forge is very proud to be an original and continuing partner of the National Resource Center on LGBT Aging. Question 18. Transgender nursing home residents have federally protected rights to dignity, self-determination, and the right to file grievances without retaliation. True or false? The answer is true. These rights, among others, belong to all nursing home residents. Complaints can be filed with the local long-term care ombudsman. You can contact your state's ombudsman program by consulting the directory at www.ltcombudsman.org/ombudsman. A disproportionate number of transgender and gender non-conforming people in the U.S. have been incarcerated, making the rights of incarcerated people an important issue for trans communities. Question 19. Transgender people's increased risk of sexual assault while incarcerated has been recognized and specifically addressed in federal policy. True or false? That answer is true. The regulations implementing the Prison Rape Elimination Act include multiple protections specifically for incarcerated transgender people. If you want to know more about this, Forge has an online webinar on the topic at our website, www.forgeforward.org. Our last question is about Trans-Pacific Cultural Competency Training. Question 20. Every service provider and policymaker has free 24/7 access to transgender cultural competency training materials. True or false? The answer is true, and the URL on your screen is where you can find them. Currently, Forge has more than 24 free transgender training webinars on our website that anyone can listen to at any time of the day or night at no cost. We are currently adding at least 8 webinars a year to this list, so come back and send your service providers on a regular basis to see what's new, or sign up to be notified by email each time a new one is uploaded. You can do that by clicking on the subscribe button on the upper right corner of each of Forge's web pages. Because many people interested in transgender policy issues are not aware of who's doing what on the federal level, we are going to take a few moments to introduce just a few of the key players you should know about. The New Beginnings Initiative is a coalition of LGBTQ organizations that was formed after President Obama's first inauguration. Also known as NBI, it has staff at the National Gay and Lesbian Task Force and helps coordinate efforts to change or improve federal administration policies that impact LGBTQ people. In other words, things that Congress does not have to pass. Forge is part of 3 committees that address our primary interests and areas of expertise: aging, anti-violence, and health. The National Center for Transgender Equality, also known as NCTE, is unquestionably the primary and certainly the most effective transgender advocacy organization that U.S. transgender communities have. Mara Kiesling is its executive director and was part of its founding in 2003. Harper Jean Tobin is another critical NCTE staff person. She is a lawyer and is NCTE's Director of Policy. Lisa Motet started the Transgender Civil Rights Project at the National Gay and Lesbian Task Force in 2001. She is now NCTE's Deputy Executive Director. Kyler Brodus, who was the first openly transgender person to testify before Congress, has taken Lisa Motet's place as Senior Public Policy Counsel at the National Lesbian and Gay Task Force's Trans Civil Rights Project. We have come to the end of our 2013 policy presentation. There is still much work to be done to achieve full equality for transgender and gender nonconforming people and families, but we have made amazing progress, amazingly quickly. If you would like to know more about how you can help, please contact FORGE, the National Center for Transgender Equality, or the National Gay and Lesbian Task Force. Thank you.